You are officially invited. Yes, you. You're invited to join us in Fertility Awareness Mastery. This is my 10-week program designed to help you gain confidence using fertility awareness. Whether you're actively avoiding pregnancy or looking to optimize your cycles for conception, we have a spot for you. We start on April 23rd. Are you ready to jump in? Head over to fertilityfriday.com/group program to reserve your spot today. That's fertilityfriday.com/group program. This episode is brought to you by my very first book, The Fifth Vital Sign: Master Your Cycles and Optimize Your Fertility. With over 1,000 research citations, it is the most comprehensive resource on fertility awareness and the menstrual cycle to date. The Fifth Vital Sign is available for purchase on Amazon in ebook and paperback formats. Audio is coming. And you can grab the first chapter for free over at fertilityfriday.com/vitalsign. That's fertilityfriday.com/vitalsign. This is the Fertility Friday podcast, episode number 248. Welcome to the 248th episode of the Fertility Friday podcast. Thank you for joining me today. I'm Lisa from fertilityfriday.com, and this is your source for information about the fertility awareness method and all things fertility. I've got a great episode for you today. In today's episode, our guest, Andrea Thompson, is talking about abdominal therapy modalities. And this is a topic that has come up on many of our previous episodes, and it's kind of like a theme that's thread through a number of different episodes over the years. And one of the reasons why abdominal therapy modalities, if you're not, familiar with them, so I've interviewed Arvigo practitioners, I've interviewed practitioners of Mercier therapy and fertility massage therapy. And the common thread that goes through these abdominal therapy modalities and even pelvic floor physiotherapy, but the common thread that goes through these modalities is just the concept of supporting the body physically and ensuring that the uterus and fallopian tubes are in proper alignment, ensuring basically that we're connecting with the body and looking physically to see if we have any symptoms that could be a result of just the physical location of the uterus, or to make sure that there's scar tissues or adhesions. And I think that it's really important and helpful and even exciting to talk about the possibilities of healing modalities that address the physical aspects, especially of our reproductive system, because this is one of the areas of our body that we're often really disconnected to. Even just to think about it, if you're having serious, severe menstrual cramps over the years, the last thing that we think about is if the placement of our uterus could be, misaligned, and if really there could be like a physical issue. We typically don't think of it that way at all because we're so disconnected from our reproductive anatomy. And I feel like, this conversations around the massage therapy modalities really help to connect us with this very physical aspect of our bodies and our menstrual cycles. I mean, because these are our internal organs, we're definitely disconnected from them because we can't see them every day, but they don't have to be a mystery. And so I feel like, massage therapy and physical therapy modalities help to connect us to the physicality of our bodies. And for many women, it's often the first time when they're actually feeling more connected physically to their reproductive organs. So I know you're going to enjoy today's episode with Andrea Thompson. And before we jump into today's episode, I wanted to personally invite you to join us in Fertility Awareness Mastery. This is my 10-week fertility awareness group program where we dive deeply into fertility awareness charting. If fertility awareness is something that you've been thinking about jumping into, or if you've started charting, even if you have a lot of charting experience under your belt, but you haven't yet got to the point where you're feeling really confident in your observations, you haven't yet started to feel confident about understanding and interpreting your cervical mucus patterns or your temperature changes and shifts and how to figure that all out, or even your cervical position or a combination of all of it. At the end of the day, it really comes down to the confidence. If you're wanting to use fertility awareness as your primary birth control method and you're wanting to actively avoid pregnancy in order to get that high effectiveness rate, but more so for you to have that peace of mind, that you're doing it correctly, that you understand everything, and that every single day of your cycle, you're really clear on whether or not it's a fertile day. That is what we do. This is what we do in the group, and that is what it's all about. If you're planning for conception in the future or actively trying to conceive, or if you have concerns about your menstrual cycle, if you've been charting and you're noticing that some of the patterns don't really follow what we would consider to be, the parameters of a healthy cycle, then this group will help you to really zone in on what what we can learn from your menstrual cycle and really help to support you to identify where we should be looking health-wise to improve those parameters, improve overall fertility, and improve your chances of conception. And so for more information, make sure to head over to fertilityfriday.com/group program. We're starting in April, so you have a little bit of time, but the spots will fill up quickly. Every time I've run this program, it's sold out. So if you want to make sure that you have a spot, then make sure to register early so you can take advantage of early bird pricing. And so again, that's fertilityfriday.com/group program. Looking forward to having you in the group and seeing you there. Now, without further ado, let's jump into today's episode with Andrea Thompson. And I'm very excited to welcome my guest, Andrea Thompson, to the show today. Andrea is a massage therapist with a specialization in craniosacral therapy. She is a certified fertility massage specialist and is also trained in the Arvigo techniques of Maya abdominal therapy. And in today's show, we'll be talking about the emotional aspects of fertility and conception, how it plays into menstrual cycle health and fertility, and also how it relates to the physical aspects of the body, so how it relates to body work. So without further ado, welcome to the show, Andrea.
Thanks, Lisa. I'm excited to be with you today.
Well, thank you so much for coming on the show. And, I always like to start by getting a sense of your background and kind of what drew you to the work that you do. And so I'm curious, obviously your background is really in body work. And I'm just curious as to how you then came to specialize in fertility specifically.
Yeah, so I've been doing massage for about 20 years now. And I'm one of those people who has kind of their entire life been really drawn to pregnant people and just like fascinated with the idea of pregnancy and how the body shifts and changes and goes through so many phases and that we can create an entire being out of ourselves. It's pretty magical. So early on in my career, I wanted to have some form of a focus around that. I actually, on kind of a weird side note, I had learned about intravaginal work for people and was told that it wasn't something that I could do. And then learned years later that as a massage therapist in Oregon, that is something I can do. But because I didn't learn that until years later, I shifted my focus into working with babies with craniosacral therapy and then realizing from that there was a whole line of work that was based on fertility and kind of had my mind blown that like, oh my God, body work can actually help people get pregnant. And at the time and kind of still currently, there's two pathways you can, or not two, but kind of two people who really specialize in it. There's a woman named Claire Marie Miller who does Nurturing the Mother body work. And that was the first line of work that I started doing. And that's how I became a fertility specialist. And then I went down the other line, which is the Arvigo work with Rosita Arvigo. And so both of those really have just been kind of the focus of my career for probably the last 7 years or so.
Well, and you mentioned intravaginal work. Do you mean similar to pelvic floor physiotherapy, where you actually support a woman by massaging her actual vagina?
Exactly, yes. And that's a line of work that I'm going to be stepping into soon, because what I found is that it's really, really crucial and powerful, in particular in regards to dealing with aspects of the menstrual cycle that I can't kind of get figured out from doing the Arvigo work. And also really helpful for women or female-bodied people when they are pregnant to prepare them for having, an 8-pound bowling ball pressing on their cervix for so many hours during delivery. So it can be really, really helpful for various stages of the fertility process.
Well, let's start by orienting the listeners to this whole concept of fertility massage therapy and body work specifically in that area. And so, as you know, I've done several episodes around this. And one of my very first episodes, so back in episode 18, throwback, I interviewed Dr. Rosita Arvigo, and that was, I remember it vividly, and it all came about because I didn't really know a lot about Arvigo therapy, fertility, massage modalities, and I certainly didn't know anything about vaginal steaming or just any of those practices, those kind of non-invasive practices aimed at making a change physically to a woman's alignment and, her reproductive organs and things like that. And so throughout the years, I've touched on that topic with various guests. So I'll link all of those episodes in the show notes, especially if this is new to, someone who's listening to the show, or perhaps a new listener. Welcome. But maybe just take us through that. Talk to us about fertility massage therapy, body work, and, when it would be important who can benefit from it. Just kind of give us the basics.
Yeah. So what I like to tell people is, if you are even contemplating becoming pregnant within the realm of like a year, then that's when you want to start getting the body work. A lot of people will come to me when they've been trying for quite some time and it's not working, and I'm kind of like a last resort. And that's great. It's still like they're coming in, we're figuring things out, we're getting things dialed in. But really, it's this really beautiful prep before you actually want to attempt to get pregnant. And it's nice for anyone to do it because, one, it just really supports your entire body, and in particular your sexual system or your reproductive system. But also, if you're having issues that you're completely unaware of, because we still live in a world where we don't actually talk about what is a healthy menstrual cycle and what is a healthy sex drive and what, how does this all work together? It's great because we can kind of like knock some things off of the chopping block that get you closer to being able to conceive much faster and much easier. So it's great for people to kind of do it before they're in the process. Then it's a little less stressful. But inevitably, I typically have people come to me and like, I've been trying and it's not working and I don't know what to do. So one of the things that I always start with is what you do is like, are you charting your menstrual cycle? And if you are, what's going on? Because again, I tend to find that people don't know when they're ovulating and don't know any of the signs and symptoms in their body when they're ovulating and aren't trying at the right time. And then we start diving into all these other aspects around what's going on with your nutrition, what's going on with your digestion, what's going on with all of these other systems that really support your reproductive cycle. Before I even get my hands on their body, I want to know all of those details and all of those pieces because they're so interconnected. What's going on with your stress and your work life and your emotional life, and how are things with your partner? Because as you well know, anytime we have disruption in any of these systems, it leads down this like cortisol inflammation pathway that throws the adrenals off, which then throws our menstrual cycle off, and it turns into kind of a messy situation. But for the actual body work itself, the physical aspects of it, the reasons why we do it, or really kind of the benefits of it, are that we're bringing a ton of circulation, just like Rosita always says. We're bringing in blood, lymph, increasing nerve reception, oxygen, and energy flow into the reproductive areas. And so with our Vigo work in particular, we're working along the diaphragm to open up the diaphragm, getting more oxygen to the entire body, increasing circulation through the entire body, and then also getting the uterus aligned. We want to make sure that it's in proper alignment. So not only does it help clean up our menstrual cycle and get it nice and healthy and things flowing really well, it also puts the uterus in the proper position to carry a baby and make your delivery process easier. One of the things that people don't think about is that if your uterus is out of alignment, it's not this kind of standalone issue, because if you are trying to get pregnant and you do end up conceiving, then when you are carrying that baby, it's going to change the positions that baby is able to be inside the womb, and also change how easy your delivery is. If it's cranked or tilted to one side, or if it's tipping in a particular direction, the baby's going to have a limited amount of space in one area or the other, and that makes delivery a little more complicated. So those are kind of the aspects that we deal with our Vigo. The posterior work along the sacrum and the low back is to really support the ligaments of the uterus, open up the tissue, the muscular tissue that supports the pelvic floor. So again, we're just kind of creating space, opening things up, getting really good blood flow, and a healthier pelvis. With the nurturing the mother work that I do, we focus a lot more on the digestive tract itself. So we're doing a lot of massage work through the intestinal tract to get things moving and flowing because, again, the colon and the uterus sit side by side. The uterus is right anterior in front of the colon. And so anytime we have constipation or any sort of backup in our digestion, it actually creates a lot of toxins that can seep into the uterus and create a lot of inflammation, pain, really uncomfortable menses, things like that. So we're trying to clean the whole digestive tract out. And then we do a lot of acupressure points that are related to the endocrine glands. So those are, of course, all of those hormone producing organs in our body that really support how our menstrual cycle goes. So we're doing points for the thyroid, the pituitary, the adrenals, the pineal gland, all of these organs that are really crucial to our estrogen, progesterone, testosterone development. And then a lot of it is kind of de-stressing the body and getting the body to relax and to open up and to just calm the whole nervous system down and to again, bring those cortisol levels down, bring the inflammation in the body down, do anything that we can to really help the body to be in its prime place to be able to conceive.
Mm-hmm. Well, I mean, as you were talking about those things, I think what I really appreciate about fertility massage or, these body work modalities is that, I mean, we live in a world where a lot of us are really disconnected from our bodies. And,
yes.
And as women, not only are we disconnected, but because we're not really taught about the basics, even the basics of reproductive anatomy to any significant extent, even just having the ability to conceptualize your uterus inside of your abdomen and, just having that concept that, it should have the ability to kind of move around throughout your menstrual cycle and just to have that just physical sense. I think a lot of us are thinking about, okay, what supplements do I need to take? And what do I need to eat? And all of those things, which are extremely important. But what I love about body work and talking about these massage modalities or these massage therapy modalities is that it really brings us back to the physical body and just the very practical sense of, is your uterus in the right alignment? Do you have proper circulation and blood flow to your uterus? And is there anything that we could do to improve that? Because just by doing that, without any of the other things we jump to, like supplementation and, all the dietary changes and all this stuff, without even doing any of that other stuff, just by addressing the physicality of the body, we can make such a profound impact.
Absolutely. Yeah. And it's kind of shocking and a little sad to me. It's one of those things that happen. I do charting classes as well. And when I start talking about this changes in the position of the cervix, people's minds are just blown. And I think, wow, how is it that we don't actually have this awareness of what's happening in ourselves, or even just the cervical fluid itself and how that changes throughout the menstrual cycle? And people are like, oh my God, that's what that is. And honestly, that was the same for myself when I started charting for myself probably 7 or 8 years ago when I took these fertility classes. I was actually angry. I was kind of like, why has no one told me this? And why have I thought things that are naturally happening to me every month that are so normal, I thought they were weird or something was wrong, and that my cervical fluid and the amount of it and how it was presenting for me was like I had an issue. And then I realized, no, that's just what happens throughout your menstrual cycle. These are normal things. And then it's the same when I'm working on people with their uterus. I'll, kind of figure out where their uterus is positioned, and they're kind of just shocked of wow, how did I not know that? And then part of it is we don't touch our bodies in these ways that are very exploratory many times. it's particularly like through the back of the body as I'm working along the sacrum and along the gluteal muscles. People are blown away at how much tension they have and how much pain they carry. And it's kind of shocking for me sometimes, even when I go to touch a body and like the person is so disconnected from what's really happening in their own body. And it is because we just, in particular in our culture here in the United States and a little bit in Canada, I think you guys may be a little more progressive than we are. But and in many cultures really around the world still, we just don't have a ton of body awareness. And having that little piece of knowledge can really change the outlook for many people on what they're doing in regards to their fertility.
Mm-hmm. Well, and so maybe you can share with us how it comes together when you're working with your clients. And what I mean by that is, I mean, there's this physical thing, right? So I'm sure there are lots of times when there's an actual physical thing that you're gently correcting and tension that you're helping to release. And so a very kind of practical physical application of this knowledge. But I'm sure there are also times when it's more than that. As you mentioned, people do carry a lot of tension. And when you were talking about it, I just had this kind of image of, you don't even realize how tense you are. You don't even realize how much pain you're in because you're so disconnected. But you don't have to talk to very many massage therapists to also hear their experiences of, working with a certain part of a person's body. And then all of a sudden the person has an emotional response to something, again, similar to the tension, maybe weren't aware that they were carrying those emotions in that place. So I'd love for you to talk a little bit about that aspect as well.
Yeah, so this is definitely something that comes up pretty frequently when I'm doing the work. And part of it is because when we're doing work through the abdominal region, through the abdomen, the pelvis, the front and the back, these are areas that are really vulnerable. It's where all of our organs are. It's like the most vulnerable part of our body that isn't protected by like big burly muscles or big bony pieces. Our organs are just kind of sitting there super open. And because of that, it's an area that we very subconsciously try to protect. And so we hold ourselves in ways that kind of keep that area protected and closed off. And it also tends to be an area, if you kind of look into various cultures, traditionally through the abdomen and the pelvis, those are the areas where we tend to hold our most private emotions and where our trauma tends to sit many times, because no one's going to just like grab our arm and all of a sudden we're going to have like some big emotional breakdown. No one tends to grab our belly or grab our, like our uterus. It's not an everyday affair. So they're very easy places for us to kind of hold our pain and hold our trauma. And in particular for female-bodied people, this is something that it's an area where we tend to hold trauma around miscarriages, which is incredibly common and people don't talk about. If someone has had an abortion, and even if it was, an abortion and they felt really good about that choice, a lot of times the remorse or the regret or just the sadness around not having that baby in their life gets held there. And also what I've been finding, because I've been working with a little bit more of the queer and trans community lately, is a lot of our body dysmorphia and our anger and our frustration around being in a body that we don't connect with gets held there. And so what happens is as I'm doing the work, many times these emotions, as I'm working the muscular tissue, when you start to get that muscular tissue to open up, those emotions that we've been clenching and holding on to and the stories that go with that also start to unfold. And people will have, very emotional experience on the table, which can be incredibly beautiful because they find that even sometimes the things they thought that they had processed and worked through, like around a miscarriage or a previous abortion, this physical piece that's still tied to it finally gets to let go. And they can find full completion in that so that their body is a little more clear, so that their emotional being is a little more clear, so that they can be really free and open to bring in a new baby. It's really powerful. And I found that it's been really incredibly powerful for kind of the queer and trans community because many times when you're in a body where you don't want to be menstruating, you don't want to be dealing with having a uterus, you don't want to have any of those issues, what tends to happen is we then clench down and hold and tighten that area because we cut ourselves off from feeling it at all. And then it makes the symptoms worse because when we disconnect from a piece of our body has this really kind of horrible and beautiful way of like knocking and knocking and knocking a little louder and increasing the pain and knocking even louder until it like kicks the door down and is like, pay attention to me. Like we need to deal with this. And so having someone to be able to put their hands on your abdomen and on your pelvis in this very gentle and loving way that's incredibly supportive really opens the door for all of that tissue to really let go of all the stories that it's holding so that you can finally kind of be free and really work with things in a different way and have these beautiful releases that allow you to kind of honor the process that you've been through in your life and move forward in a way that's really clear.
Mm-hmm.
Does that make sense? I realize as I'm saying this, I'm getting all caught up in all of my stories with my clients.
No, it makes perfect sense. I suppose the thought that came to mind, I mean, it's hard enough to identify as a woman, being in a woman's body. And because, I mean, women who identify as women in women's bodies, we still are often quite disconnected from certain parts of our body. And I mean, we could unpack that forever in terms of why that is, right? Like we live in a world that's very male oriented. Our medical system is largely based on the male body. And there's a lot of negative messages that we get about our own bodies that prevent us, at times from being able to connect fully and to just even to appreciate and love all of these different aspects of ourselves. So the point that you brought up, working with your clients who are trans, who, not only are they in a female body, and potentially disconnected to it, not only that, but they don't even want to be in a female body because it does not reflect their gender. So I'd like to go there a little bit more and kind of unpack that a little bit, because I feel like just as a woman who identifies as a woman in a woman's body, it can be incredibly difficult to connect to these aspects of their body. How do you support somebody who, doesn't even identify with their body at all, connect to it?
Yeah, absolutely. It's a slow process many times. And a lot of it is me reminding them that they don't have to love these pieces of their body, right? It's not like I'm trying to get them to this place where they're like, it's epically amazing to have a uterus, which I think it is, but it doesn't mean that they have to. Sometimes people are like, you are way too excited about having a uterus. And this is true for cis women who have a uterus, who've had horribly painful menstrual cycles. Like they're not super happy about it either. And so what my goal is in particular with trans and queer women, is that I want them to get to a place where they don't have to love that part of their body, but they do have to connect with it. And they do have, in my personal opinion, to be able to feel into it and to honor that it has a cycle, and that cycle is a part of it's a cycle that's not going to go away, right? And that if they can find a way to just honor that organ is in their body and it's doing a job and it's working as hard as it can to do all the processes that it's made to do, if they can even get to that place, many times that will shift their cycle for them, and that alone helps them having a uterus and having a menstrual cycle so much easier. So it's a slow process. A lot of it is kind of in baby steps of like getting them to have some awareness of that area, and the massage, just the basic massage in and of itself, having someone touch them there in a way that isn't sexual, because many times when we touch in the abdomen and when we touch in the pelvis in the world, it's usually in a very sexual manner. To have someone go in there in this way that's not sexual at all, with no expectations, and to just have the body being supported can be really healing. And it helps bring awareness to that area without this need for it to be something it's not, or something that they don't want it to be. And then it's kind of, baby steps. A lot of times I do a lot of the craniosacral work that I do in these kinds of scenarios when there's trauma, sexual trauma, gender trauma, miscarriages and abortions. It's a lot of times when I'll start bringing in the craniosacral pieces, because it is really gentle and lovely. And I can do some dialogue with the person and actually with their body, which helps me many times to have them start to have a conversation. Start to have a conversation with that body part itself, and to really explain to that body part, I don't really like you and I don't really want you to be a part of me. And it will have a response and be like, well, this is my job. And so it's a process of getting kind of the brain and the body to have a conversation and work out a deal, work out a little compromise of okay, well, if I'm clearly not going to get rid of my uterus, then how can I actually work with it? And it's different in every case, right? Every person that I see has a different story, and how we have to get there is very different.
Mm-hmm. Well, and you mentioned the craniosacral work that you do. So just share with us what that is, so that everyone is on the same page.
Yeah. Craniosacral therapy is this really sweet modality that is hard to put into words. So I'm going to try my best. It's a hands-on modality that is very gentle. So the amount of pressure that we go in as we're working on the body is typically the weight of a nickel. It's 5 grams. So we're going in with really light, gentle pressure, because that helps the body to not put up defense mechanisms. Because typically, if you go in with deep, full, intense massage strokes, the body's going to, if you already have kind of trauma in the body is going to respond with back off, right? And so with craniosacral therapy, we go in very light and very gentle and engage the tissue so that the body doesn't put up its defense mechanisms, but also so the connective tissue itself in the body, which is what we're really focusing on with craniosacral therapy, that it says, oh my gosh, someone is listening to me. I can actually work through all of this tension that I've had for so many years, and someone's just going to support and listen. And so it's this way of engaging with the connective tissue and kind of giving it a little nudge so that it can then go through its own release process. And I've been doing the work for a really long time. So there's another aspect of it that's called somato emotional release, which is somatics, which corresponds with the body, emotions, which we're talking about, and release. And so that's when I start using the dialogue. It's when I'm engaging with the tissue, and there's definitely an emotional response that's coming with the work that I'm doing. And then I dialogue kind of around that to help the emotional piece be clear so that the physical piece can fully release connective tissue wise.
Mm-hmm. Well, and this is making me reflect on some of the different topics. I mean, one of the topics that has come up quite a bit with respect to body work and, for fertility massage modalities is just that the different ways that massage therapy can improve fertility. And that we touched on that a little bit. So I would love to hear just a little bit more about what you found in your practice and how using a physical massage modality can support fertility. And also, I think what I've spoken about quite a bit on the podcast is how it can help with complaints. So if you have painful periods or some actual complaint, but just more of the general sense of how it can support fertility. But then the other aspect of it that I really haven't gotten into a whole lot on the podcast is in terms of preparing for pregnancy. And that's something that you mentioned as well regarding just supporting the body to prepare for the incredible feat of carrying a tiny human.
Yeah.
So maybe you can take us through some of those things.
Yeah, absolutely. So, definitely again, like when I do the work, it's kind of full circle. So we do talk about like what's your nutrition and how can we clean up your diet so that you're having all of these really important building blocks that support creating a human being in your belly. And then how are we going to like decrease all of these inflammatory foods, because those inflammatory foods also lead to more inflammation in the body and are creating pain as I'm doing the massage work. As we do the massage, as we're releasing physically, as we're releasing the tissue that is tight and spasming and holding things, that is helping, again, your whole nervous system to calm down, which is incredibly important because the more we decrease the like instantaneous nervous system response that goes with stress, we decrease those cortisol levels, which help our adrenal glands, which help our ovaries. And again, that helps regulate our menstrual cycle. Many times I encourage people to do vaginal steaming. It's a beautiful, beautiful practice. And that in and of itself can really help clean up the menses. So if you're having dark blood, if you're having painful cramping, if you're having excessive bleeding, or you're not bleeding regularly, getting those steams in can really help shift the way that the menses itself presents. And that is crucial. On the very physical level, what we're doing, again, is bringing a lot of oxygen, blood flow, nerve impulses, and energy to the whole abdominal region, the abdomen and the pelvis. And that helps any tissue to be healthy, right? So like if you have really poor circulation and your feet and your hands are super cold, they're going to turn kind of purple. They're going to ache, they're going to hurt, they're not getting enough blood, they're not getting enough oxygen. If we can increase the amount of blood and oxygen, they get warm, they get pink, they are healthy. We're doing the same thing to the entire pelvic region. So that really helps support the health of the ligaments in there, as well as the muscles in the pelvic floor and the uterus itself, because it is one big giant muscle. It also really supports the diaphragm to increase our breath, which can be great for decreasing anxiety. And then really that intestinal tract, right? Like as we're doing massage along the intestinal tract, that's helping to detox your body. The more toxins we can get out of the body, the healthier it is. So a lot of it is kind of this cleanup system. I work a lot with castor oil packs, which are great to do on the abdominal region to help clear out your digestive tract, but also castor oil packs can be really great to help dissolve cysts and help fibroids to shrink, and also to detox the uterus itself, so it can really help flush old stagnant blood out of your uterus. It's great for scar tissue as well. This is kind of a random side note, but I was thinking about how important it was to say this. If you have any tattoos along your sacrum or along your abdomen area or along your ankles, because the ankles have reflexology points that correspond with the ovaries and the uterus and the fallopian tubes, rub those down with castor oil as much as you can, because even though there might be some like lovely, beautiful tattoo, that creates scar tissue in the body. And if you can work those with some castor oil, it actually helps increase flow in those areas, which again is what we need and is incredibly crucial. So really, a lot of the work is to support all of these ligaments that hold the uterus in place, so that as you do carry a child, if you do get pregnant, those ligaments are going to be super strong and super healthy, but also flexible in a way that works for the body, because we really want the uterus to be able to move, and we need that perfect combination of strength and flexibility. The balance between the two is really important.
Mm-hmm. Well, I mean, I think that's really helpful to get that sense of what it's doing and why it's helpful for fertility in general. I feel like it's quite clear when you describe it from that physical perspective of improving circulation, improving the body's ability to detoxify, improving lymph flow and blood flow and all of those things. I feel like it makes a lot of sense. I think it may be hard to many times, and I'm sure you found this as well, but many times when you're working with somebody and when you address some of these basic things, kind of like the things that you wish that, medicine would go to first, right? But when you address some of these very basic things and when you're charting your cycles, it's incredible. I suppose it kind of throws women off like, wow, like just doing something like this could make such a big difference. And I think there's something to be said for, in many ways, the simplicity of this concept. Don't let that fool you. It can make a profound impact, right?
Absolutely. Yeah. And, if you think about in particular, like if we're using the positioning of the uterus, and if the uterus itself is kind of like tipped to one side, the way that the ovaries sit, it's not like they have a ton of free space. So if it's kind of cranked over to like the left side of your pelvis, that ovary is going to get smashed along the left side of your pelvis. And if it's getting smashed, it's probably, in all likelihood, going to have a hard time ovulating in a way that's really healthy. So that's going to change kind of that hormonal output, right? It's going to change the way that progesterone gets pumped out if the follicle that the ovum is trying to pop out of is smashed up against the wall of your pelvis. And so little things like positioning can really change the way our hormones are interacting and engaging. And so
can I just interject there? So for the listeners who don't know this, it is your ovaries that produce estrogen and progesterone. So because I realize as you're saying that, we kind of take for granted that like we know where it comes from. So that's this kind of aspect of physicality regarding the placement of your uterus and your ovaries can absolutely play a role in your hormone production because that's where the hormones are produced, the main reproductive hormones in your menstrual cycle.
Exactly. Yeah. So there's all these little pieces that have to do with our physicality that we don't really think about. And it changes things. So as we're kind of like encouraging the uterus to go back to center, it's actually encouraging the health and the vitality of that ovary so that it can function. If someone has excruciating ovulation pain, it's very likely that they either have some scar tissue around that ovary, that they possibly have cysts, or that ovary is being really cramped. And in all likelihood, that's also going to be changing a bit the hormonal production and how that presents in the body and throwing the rest of the cycle off. And so as we kind of shift the physical dynamic of what's going on with that ovary, it's going to shift the hormonal dynamic and it's going to shift the menstrual cycle completely. And it's very true as well of when people have really painful menses or when they have dark brown blood. I actually had a woman come in recently who was having like really smelly, stinky black blood. And she was my best case scenario really of what could happen because she presented with these really horrible symptoms. And after 3 sessions, she was back to regular cycles. And it was one of those like, yes, this is why I do the work that I do. This is like, it was beautiful because I was doing the massage with her. She was going home and doing her self-care, which is her own massage protocol, doing the castor oil packs and doing regular steaming. And within 3 months, she had a normal menstrual cycle. That's amazing. Mm-hmm. Like 3 months of someone coming in a couple of times a month versus going to a fertility clinic and spending tens of thousands of dollars to have someone like make something happen for them that still actually doesn't change your hormonal cycle. And this is the piece that I think is really important for people to think about who are struggling with fertility, is that when you go to a fertility clinic, not saying that they're horrible because some of them are really amazing, but many times they're not going to deal with the issue that you have in your body. They are going to do whatever it takes to get you pregnant. And many times what that means is ramping you up with a bunch of more hormones, not dealing with why you have a hormonal imbalance to begin with, not dealing with why your uterus is maybe not functioning as well as it should because of positioning, because of any particular reason. And so if you can, instead of doing that, really start to work with what's happening in your physical body by having body work, what's happening in your emotional body by really processing any of like the trauma and the stored up stuff that you have in yourself, and then also changing your nutrition, changing your lifestyle. Many times you can do all of that for a fraction of the cost of what it would be to go to a fertility clinic to then deal with the kind of long-term issues that can occur from being pumped up with tons of hormones to be able to get pregnant.
Well, and if your uterus is out of balance, for example, and that is contributing to this whole issue, then getting pregnant doesn't fix the uterine imbalance issue. And in my interview with Dr. Rosita Arvigo, when she was talking about vaginal steaming and just that concept of your uterus as a home for your baby, and this theme has come out in several of my interviews, but just to think about it that way as the first home for your baby. And, you know, imagine, as you mentioned, your client who had this, you know, like kind of distressing looking bleeding, like very dark in color, kind of snotty and with a smell. Like none of those things fall under the definition of normal or optimal. So just, you know, picture working that stuff out, right? Getting that buildup or residue or whatever you want to call it, cleaning it out essentially, such that when you do conceive, not only is your uterus aligned and in balance and you have better circulation and blood flow and all of those things, which you need when you're pregnant, right?
Absolutely.
Circulation and blood flow. I mean, come on, this is like your blood volume, you know, I'm not sure if it exactly doubles, but your blood volume increases significantly during pregnancy. But, you know, in addition to that, just picture it's within your uterus is your endometrial lining. And that is essentially the first home for your baby. So what you want ideally is a beautifully, fully developed, fresh, you know, clean, red, happy uterine lining.
Absolutely. Yeah. And I think it's one of those things that in particular, when people get really urgent about needing to have a baby and like, oh, I want to get pregnant next month, and it's really important, you know, they kind of get caught up in the idea of having a baby and they forget about like what kind of space are you creating? What kind of, like you said, what kind of home are you creating for this baby to be developed in? Because if you get so caught up in the idea of it happening by a particular time frame, many times you forget that there's a lot of steps that you want to put into place first. And those steps are crucial, that this child is, one, created in a really loving condition, but also in like the healthiest, most clean possible condition, so that as it develops and grows, it's not having any other issues come into play that wouldn't necessarily be there. You know, there's a lot of studies now around epigenetics and kind of the trauma that we carry from our mother and their mother and as the line goes back. And so for me, it's about not only should the body be physically clean, but how can we make it emotionally clean? Like how can you change your stress levels prior to conceiving as well as during pregnancy so that you decrease the likelihood of your child coming out with kind of some long-term dynamics around stress, around health, around food issues, around things that we are just now beginning to associate with conception. I think about like food allergies and asthma and anxiety and depression being things that are related to what was going on in the womb. But those are actually conditions that can be related to how healthy and clean is our womb as the baby is being developed.
Well, and I always feel like putting out there, because I'm always thinking of, you know, who's listening to the podcast. So, I mean, there are women who are listening to the podcast who are fully pregnant right now and did not do any type of womb cleansing or anything like that. And so I suppose like the purpose of it isn't to say there's never perfection. There's no perfect time. And, you know, I feel like it's helpful to
Absolutely
acknowledge and honor that. And wherever you are in your journey, however you conceived, whenever it happened, in whatever way, I mean, that's the way it was supposed to happen. The purpose of this conversation isn't to make anyone feel bad or to kind of make it seem like, you know, there's one great way over another way, but I think it's helpful to kind of have these ideas in mind. I think many of us, it's kind of like the way we talk about, the menstrual cycle when you learn fertility awareness. Like, you wish you would have known this when you were younger. And I feel like in the same way, this is information that would be really nice for all of us to have growing up, about just to think of our uterus in this way and to conceptualize it, to really think about it as a part of our bodies, and, what can we do to encourage a healthy uterus? I mean, a healthy uterus is really important. Anyone who's had period pain or really hard periods knows that. And so I just kind of want to put that into context in terms of what we're talking about with cleansing the uterus prior to conception.
Absolutely. And I think, on that a similar note, it's also really wonderful for people who already are pregnant to start kind of incorporating things that maybe they haven't had a chance to. Because again, anything that we can do that is going to take stress out of our lives is really helpful. And what I always tell my clients is, when you are pregnant, start getting massage. I do pregnancy massage as well. I'm always shocked at how many people who are pregnant who don't have body work, because your body is going through so many shifts and changes. Those ligaments, they're getting tons of prolaxin, like there's constantly stretching, and it changes the way your whole body moves. And during the different stages of pregnancy, having someone there to support your body physically can be dramatic in how you experience your pregnancy. There's usually a ton of tension through the hips because they are spreading and widening, and through the pelvis and through the low back. And as the belly grows and shifts, the way we carry the weight really changes. And so having body work on a regular basis during your pregnancy can be a godsend. I also really encourage people, if they are pregnant, to start doing yoga that is based on pregnancy, because it really helps to prepare you for labor. And part of that is a lot of the pregnancy yoga or the prenatal yoga helps keep space in your womb, right? It's giving the baby a lot of space to move around and kind of not get stuck in any particular pattern while being in the womb. If you can't go to yoga, because not everybody has access to that, then definitely try to stay fairly physically active. Clearly, I don't want people going out running marathons, although there is a woman who did run a marathon while pregnant. But getting a lot of physical activity that involves your hips and your sacrum is really, really powerful. So doing some squatting, going dancing, anything that keeps movement through the whole pelvis as you're pregnant actually is really helpful for the baby and its positioning in the belly, and helps your labor and delivery go by much easier.
Well, there's something that I was thinking I'd like to circle back to. So we talked about, body work for fertility, and we really got into the physical aspects of it. But I just wanted to circle back to a topic that we were talking about a little bit earlier, which is how body work can kind of not only bring the tension that you hold in your body in a physical sense to the table, but it can also kind of bring up some of those emotional things that you've had. And I know you mentioned that many of us carry a lot of emotion in our abdomen area, and especially past traumas. So for instance, any emotions that we have about miscarriage or abortion or any other types of trauma that we may experience. And so I just wanted to, I suppose, touch on that connection there between some of those energy aspects and how we carry our energy and those types of things within, and how they can kind of come up in body work, and how that could relate to fertility, especially for women who are trying to conceive unsuccessfully.
Yeah. So what can happen a lot of times is our body will hold on to we get physical patterns because of trauma. So for example, if someone has been physically assaulted, what they tend to do is, or if there's been like medical trauma, they'll clench, like there's a clenching pattern that happens in the legs, right? And so that pattern becomes very unconscious, and it's something that the person will continuously do. And as they hold that tension through their legs, that tension then carries up through the pelvis and then closes the pelvis off. So there's a lot of tension in the muscles of the pelvic floor. And as we go to do the massage and loosen up the muscles around that, around the glutes that access those pelvic floor muscles, what tends to happen is it kind of can trigger that emotional response. And so as, again, we're going in this very safe and supportive and kind of loving way with the massage, the body realizes, oh, I don't have to hold this here anymore. I can actually start to relax and let go. Because anytime we clench and hold with our muscles, whether it's due to a physical trauma that we've had, like a car accident, or if it's due to an emotional trauma, a medical procedure, anytime there's a holding and a tightening and a clenching with the muscles that becomes an unconscious pattern, those muscles never actually learn how to relax. And so they're constantly in a spasm, which creates toxins that just keep cycling. And so as that cycles, we get a decrease in oxygen, we get a decrease in blood flow, and that decreases the health and vitality of those muscles. It also, of course, decreases the amount of space that we have in the womb, in the body. So as we do the massage and as we kind of slowly start to open things up, we're getting those toxins to start moving, we're getting the muscle to start to relax, and we're getting these kind of emotional pieces to let go in a way that's very different from like talk therapy, right? Like you can talk about something 1,000,001 times, but until you let your body actually let go of the patterning, it's still going to be there. And so this kind of slow and supportive massage can really help the tissue to realize it's safe and it doesn't have to hold anymore, or it doesn't have to hold the story. And this is true, I say, like, a lot of the trauma that I've been talking about has been on more of a like negative aspect, but this is also true for things that can be on the opposite end. Like sometimes I have people who have like hysterical fits of laughter, and it's around kind of the opposite end of the spectrum of what we would quote unquote call trauma, in the sense of things that they weren't allowed to express as little kids. Like if you were always told to be quiet, and like if you were, laughing and being silly or whatever, and you had a parent who was constantly like, oh, you need to be quiet and you're being too loud. Some of those things can be seen as trauma. And so when we shut things off in our body, a physical pattern has to lock that down. And when we open up the musculature that holds that physical pattern in place, those little emotional pieces will bubble up to the surface. And then we can kind of let go of all of that in this much bigger way. I recently had a client who had in the past had a miscarriage, and it was something that they felt like they had really dealt with and processed. And we did work around that. And in one session, for someone to actually just kind of hold them and support them as they went through a full cycle of like the crying and the grieving and these little pieces that they didn't realize they were still holding on to, because there was this physical connection in their belly, and working their belly started to bring these things up. When they were finally able to fully process all of that and realize like they were okay, their body was still healthy, there was nothing wrong with them, it was just what happened, they then were able to conceive. Because many times there's this, and this is a hard thing to explain, and sometimes I feel like people are like, what is this crazy lady talking about? But, our emotions and our trauma and our experiences in life many times block us from moving forward. And so we might present as someone who's incredibly healthy, like physically healthy. I've had clients who come in and they eat great and they're physically active and their life seems relatively stress-free, but for whatever reason, they're not able to conceive. And then we start doing the work, and then it's like, oh, there's this huge emotional piece here that you're still holding on to. And if we can let that go, then the body will, it's like reminding the body, like, yeah, we do really want to do this, and it's okay. We're scared, but we don't have to be so afraid that we keep ourselves from from conceiving. We keep ourselves from having the thing that we actually want.
Wow, that's so profound.
It's pretty powerful. Yeah, it's pretty powerful. And it's one of those things that I feel like, I mean, even I do it all the time. It's the work I do all the time. And even I kind of hesitate sometimes to talk about it because it gets kind of put in the land of woo and like, oh, that's so out there. But the reality is that's the human body. It's incredibly complex, and our emotions are never separate from our physicality. And when we can acknowledge that, we can realize and go to some pretty extreme depths with body work that are really powerful. And honestly, it comes up in one way or another with almost every client that I work with. Like, it's never just this like purely physical thing where I'm doing the body work and then all of a sudden it's like, yeah, that was great. Like, there's many times it's tied to some emotional story that also needs to be processed. And it doesn't mean that I then turn into their therapist, because that's clearly not in my scope of practice. But I can be there to support them through just the relief and the expression of these emotions, and kind of hold their story for them. And their body is the thing that needs the work. Their body is that like residual piece that needs the opening, so it can finally kind of go, oh, okay, yeah, we can do this. I mean, sometimes it's just being reminded, in particular with people who've been trying for a really long time, that their body isn't broken. Mm-hmm. And many times that, like, the sadness and the frustration of not being able to conceive will come up on the table as I'm doing the work. And it's really this reminder of like, it's okay, your body knows what it's supposed to do. And it's okay to grieve that it's not been doing what you've wanted it to do until now, but we can move past that. Mm-hmm. And that's the sad thing, is that many times, in particular around fertility, and also kind of in like the trans community, there isn't a ton of support and talk around how frustrating it can be and how devastating it can be and how much pressure there is. And it's one of the reasons why I really love your podcast, is because you bring up all of these issues. Like, you bring up these very, practical issues around like charting and nutrition and hormones, but also like that people can talk about how it's frustrating and it's complex, and that like many times people don't talk about that they've had miscarriages. People don't talk about that they've had abortions. People don't talk about that they've had sexual trauma. And so they just hold all of that in their body. And I think if we had more kind of conversations like you're willing to have, people would be less likely to contain all of that within themselves and get more support and have more openness, which would make the process so much easier and more simple.
Mm-hmm. It just makes me think, the body remembers.
Absolutely.
Because in another life, I worked as a sexual assault educator, and I, went to schools and taught about consent as per the Canadian Criminal Code. So ever get me in a room talking about that, I'll go on and on forever. But, yeah. Even within that type of work that I used to do, I used to do a little bit of just supporting survivors in a limited capacity, really. So if someone's in a crisis situation, just really supporting them and giving them the resources that they need. And what's really interesting about it is, in your mind, in your head, you can be completely fine. And then someone can touch a certain part of your body, and all of a sudden you're dragged right back to that occasion. So I just share that example. Your body does remember, even if you're not conscious of it. And so I feel like what you're talking about here is touching on something really important and really powerful, much bigger topic, in the sense of the way that we're just disconnected from our bodies just in general. In my work, I mean, by teaching women about their menstrual cycles and teaching them how to check for mucus and checking their cervical position. I mean, we can think about that as just a small thing, but I mean, we have, women have babies and still don't really know how their body works.
Yeah.
So this is a really big deal. And then this additional layer of just knowing how your body can store memories and emotions and how this can all be happening without your conscious knowledge. I feel like that's a really helpful piece of the puzzle for the women who are listening to our show today.
Yeah, I'm hopeful that it is because, I think it's a really big piece of the puzzle that, like I said, just doesn't really get addressed.
Mm-hmm.
Yeah, I feel like it's really crucial.
Well, and we've really, this episode, I've really enjoyed our conversation. And I mean, of course, we could continue talking all day because this is so much fun. But just to, thinking back to everything that we've talked about, I feel like we've really covered a lot. And, what, if anything, would you want the listeners to take away from our episode today?
Oh, that's a good question. I think most importantly, remembering that you are like wonderful and perfect and amazing wherever you are at right now. And that also there is always room to shift and to grow. And that part of that is really having awareness in your body and having awareness with those parts of you that maybe you're not quite as in touch with. And that it's really helpful and can be incredibly profound to find a practitioner that you really trust to do work with, because those physical pieces are so crucial, to support not only your menstrual health, but also your fertility and also, through the whole phase of it, through your pregnancy and through your labor and delivery and post-delivery. Having body work can be really such a key component to having a very healthy sexual reproductive cycle on all aspects. And I encourage everyone to kind of find someone who does work that touches on that.
I think those are amazing words to end on. I mean, there's so many more directions we could go as you were talking. I was thinking of the postpartum. So, for those of you who are interested in this topic of body work, we talked about vaginal steaming, we talked about fertility and supporting the menstrual cycle. For those of you who are really interested in this topic, I'll make sure to list complimentary episodes in the show notes because this is a topic that we've addressed quite a bit on the show. But what I really appreciate about our conversation today, Andrea, is just, I feel like we brought a lot more to the table. We brought a lot of the emotional aspects to the table, and also the thought of preparing your body for pregnancy and really getting yourself in a really good position. And also the importance of continuing the work throughout pregnancy. I feel like it really brought a lot of important pieces to the discussion. So thank you so much for being here.
Absolutely. I really enjoyed it. I feel like, again, there's so many things I could talk about as well. Like this could branch off in so many areas.
Well, and so for the listeners, we've piqued their interest. How can the listeners learn more about you and what you do?
So there are, again, to touch on the modalities that I do, nurturing the mother, fertility massage is something that they could look for. I am located in Oregon. Clearly, I can't help everyone, but there are practitioners around the world or around the United States for sure that do the nurturing the mother work. And then there are practitioners around the world that do our Vigo techniques of mine, abdominal therapy. And you can look either of those up online because those are super handy modalities to do. And also craniosacral therapy. I think it's a really beautiful modality. It's great for infants as well. So if you have had a child and you're having any issues with breastfeeding or colicky baby or just a baby that's not really going through the stages of development very well, craniosacral therapy can be amazing for that, as well as anything for adults. And then for me personally, I'm located in Portland, Oregon, and you can always find me online under Andrea Thompson, LMT.
Awesome. Well, we will put links to everything you mentioned in the show notes page. And again, Andrea, thank you so much for being here today. It was really great having you on the show.
Yeah, Lisa, I had a great time. Thank you so much for the interview.
Thank you for listening. If you enjoyed today's show, please share it with a friend. You'll find the show notes page for today's episode over at fertilityfriday.com/248. I hope that you enjoyed my interview with Andrea. It was just a treat to be able to talk about abdominal therapy modalities once again on the podcast. As I mentioned a couple of times, if this is a subject that interests you, then, there's been a number of episodes on the podcast where I've interviewed different practitioners of different abdominal massage therapy modalities, from ergotherapy to Mercier therapy to fertility massage therapy. And so it's really helpful to listen to those episodes, especially if you have an interest in this area, because it's a way to connect us to the physicality of our bodies. For women, we're different to men. Men have their penis and testicles hanging out, so they get to see them. And I don't know how you could be disconnected from it if it's like hanging out of you. I don't know what it's like to be a dude, but I would imagine that it's harder to ignore those body parts when they're in full view all the time. But as women, our vulva, that's our reproductive organs, they're just much less prominent. And especially the rest of our reproductive organs are inside. So our ovaries and our uterus are inside of us. And so it can be a bit more of a challenge to actually feel connected to that area of our body, especially because of the way that, if you think about the way that women's bodies are sexualized, and really there's only one type of female body that is portrayed in the media, and that's a very skinny body with a flat tummy. So tummies are an area for many women where, it's an area of shame, because most of us don't look like that. Most of us don't look like really skinny teenage girls, especially when we're grown women. And so if you think about it that way, that's a part of the body that can be associated with a lot of shame for other reasons, let alone connecting to our reproductive anatomy, something that we're not even really made privy to. One of my observations over the years was that, when I was a little girl and we learned about what little we did learn about kind of sex education in that period of time, I distinctly remember, our teacher putting up a slide, and it was a slide of the female external genital anatomy. And I remember looking at it, and it looked nothing like me. So the image that I saw, it's like the woman didn't apparently have any labia. So she didn't have any lips that looked like an adult labia. She didn't apparently have a clitoris with like a clitoral hood or anything like that. It was like a dot with another dot. So a dot to represent the clitoris and a dot to represent the vaginal opening. And then the labia were very understated. And I remember going home, and at some point, I don't know if it was that night or just in general, but I remember like pulling out a hand mirror and looking at my genitalia and thinking like, I don't have a dot. And I actually, for years, thought that there was something wrong with my genitalia, because my clitoris was too big, right? Because it wasn't a dot. And so I'm sure that I'm not alone in, not necessarily that exact experience, but just in general with not seeing any images of what an adult woman's vulva looks like. And any images that you may have seen in medical textbooks are physically anatomically incorrect in many cases, where they literally don't even look like actual women. Whereas, in contrast, images of men's genitalia, the penis, testicles, are accurate. They look like what it looks like. And so, if you're a man and you're looking at a medical textbook, the images that you're going to see look very much like what you have. Whether it's an image of a circumcised or uncircumcised penis. But as women, again, I have very rarely seen any images in medical textbooks that actually look like women's vulvas, and women's vulvas don't look the same. There's a variety in the size and shape of our labia and our clitoris. And so, that's just one example, and that's just the external genitalia. So I suppose what I'm saying is that, in the way that our culture treats female, even just the anatomy of it's no wonder that so many of us are disconnected from our bodies and disconnected from our menstrual cycles and our whole kind of reproductive system, from the external genitalia to the internal genitalia. So if we don't even see accurate images of our vulvas, so there's, many grown women who have normal looking grown women vulvas with, labia and, every woman's labia are different sizes. So it's very common. Some of our labia is longer than other women's labia, and they hang down a little bit if we're walking between our legs. And many women feel that they're, ashamed and feeling like there's something wrong with them, when really you just look like an adult woman, because that's what vulvas look like. But because we're not educated, and even the medical textbooks are often not showing the correct anatomy, it leaves us thinking that there's something wrong with us, even if we're completely healthy and normal. And so if we can't even connect with our external genitalia, how are we going to connect with our internal reproductive organs. So that brings us back to today's episode. It was a little bit of a ranty, but it's related because, again, it comes down to this just lack of basic information. Why are women missing from this conversation? Why are we not privy to accurate information about our reproductive organs, about our menstrual cycles, about our vulvas, about how our organs work? And why is the concept that maybe if we're experiencing pain or discomfort or even fertility challenges, that it could be related to the physical placement of our internal organs? And the thought of this gentle modality of literally having somebody go in and massage and palpate the abdomen and basically do massage therapy to ensure proper movement, proper alignment, proper blood flow to the area. Why is that such a foreign concept? Why is it such a novel thing to think that our bodies, we have this physical component to our bodies? So that's why I love talking about abdominal massage therapy modalities. Whenever I have a chance, I bring episodes to you to really cover this area, because it really helps to expand our mind, to help understand that, yes, of course, there's a place for all of the different aspects of health, whether that's dietary, whether it's getting rid of our chemical exposure, reducing our exposure to xenoestrogens, whether it's ensuring that we're getting proper nutrition from our food by incorporating specific fertility foods, whether we're supplementing to address any nutrient deficiencies that we have, whatever we're doing in all of these different areas of health, making sure we're getting good sleep, making sure we're sleeping in the dark. In addition to that, what about our physical bodies? Is your uterus in proper alignment? Could it be that you have an issue with scar tissues and adhesion? Could that be related? And so I just love opening up this conversation and to really try to connect us with what's happening in our physical bodies. So thank you, Andrea, for coming on the show. And for those of you who are looking to connect with your menstrual cycles in terms of gaining that confidence using fertility awareness as your primary birth control method, and or to gain a deeper understanding of your menstrual cycle and find out what you can learn about your overall health through charting, and even to optimize your chances of conception and address any underlying issues that might be showing up in your charts that may have been missed in other areas, I personally invite you to join us in Fertility Awareness Mastery. So we're starting in April and we still have spots available. So make sure to head over to fertilityfriday.com/group program for more information. And with that said, I just want to thank you for spending some time with me today, for tuning into the show. I really appreciate you for being part of the Fertility Friday community. And as always, until next time, be well and happy charting.